Hi, my name is Lionel Bouchet. I'm with Mevion Medical Systems. I'm talking today with Dr. J. Loeffler. Thank you for joining us at the National Association for Proton Therapy annual meeting. It's a pleasure to have you. First, congratulations on your NAPT Lifetime Achievement Award. This is a great achievement.
Well, I really appreciate that comment, and it means so much to me.
Looking back at the past 20 years, what do you see that has been an important additions to proton therapy to make it more accessible and more available for more people?
When the whole world of oncology understood for the first time that proton therapy wasn't this weird therapy of only at cyclotron labs at major universities, but it was a day-to-day treatment that could be in the hospital, could be in the community. And I think that's what really led to the tremendous excitement. Mm-hmm. And then when the results started coming in and we realized that it is better therapy for most things, not everything, but for most types of tumors, I think that really led to the explosion of interest, more than just the technology.
Yeah, and today we're seeing an increase of indications where proton is actually become a very important tool, like such as head and neck, breast. What do you see that as allow these applications to become, or proton therapy to become not a standard of care yet, but really important in managing these indications?
That's a great question. I think once the costs of proton therapy approach the costs of linear accelerator-based therapy, I think there's no end in sight. Why would you go for X-ray therapy when you can get a better therapy with protons? And my predecessor, Dr. Herman Soot, made a comment, if protons cost the same amount, or the charges were the same as photons, there wouldn't be anybody who would vote to get photons, even for palliative cases. And it really helped drive the field.
So what is important to make proton therapy a standard of care? So cost reductions, as you say, making it same level of access, financial, as conventional radiation therapy. We still have some work to do. Obviously, price have decreased tremendously.
I think the size of a proton facility, what hurt us in that period was the expense. The initial cost investment got so great, there was a backlash. Mm-hmm. People were saying, I'm not going to spend $150, $200 million to do it. But then when companies like Mevion came out with compact, relatively inexpensive units to treat patients with protons, and that's what's happening everywhere. Nobody's going to build these facilities like we built, or University of Pennsylvania or MD Anderson built. They're going to build compact units. And if you bring it closer to their patients, the referring physicians will say, oh, I have a patient who would benefit from protons, but I don't want to send them all the way into Philadelphia or all the way up to Jacksonville. But if they have a facility nearby, I think it'll lead to an explosion of continued growth of proton therapy.
Radiation oncology is a tool in the toolbox of cancer management. And proton is a very specific tool for radiation oncologists. What do you see the role of proton therapy supporting the development of new drugs in immunotherapy, in gene therapy, compared to conventional radiation therapy?
So what we showed when I was still at the Mass General, that if you use proton therapy versus X-ray therapy, you can reduce the amount of lymphocyte depletion. Mm-hmm. So if you reduce that, immunotherapy is going to work better, and it's been proven already. And that's an example, multidisciplinary care of patients with cancer. And if you can use a tool that can augment our colleagues in surgery and medical oncology and immunotherapy, it's even going to lead to further growth of protons.
Right. So what are you looking for in the next 5 years?
Multiple new units that are compact, that are efficient, that are cost effective. No question, that's going to lead to tremendous growth moving forward.
Well, I thank you for sharing all of your thoughts and your experience. It's always a pleasure talking to you. And again, congratulations on your award at the National Association for Proton Therapy.
Thank you, Lionel.